Okay, welcome everybody to our third Smilow Shares lecture in our series of survivorship lectures. This is our third out of four, and we are doing this survivorship series in honor of National Cancer Survivors Day, which here at Smilow we decided to turn into a month-long celebration. Can't believe it's already the third out of four, so a third week out of 4 weeks. My name is Heather Studwell. I'm the survivorship coordinator at the Smilow Cancer Care Center at Greenwich Hospital. Our survivorship is an area that cancer care that I hold near and dear to my heart, having worked as an occupational therapist at Greenwich Hospital for nearly 20 years, treating cancer survivors and those who are surviving cancer. And it's my pleasure to be facilitating this panel tonight on supplements and nutrition. I'm going to give you a few housekeeping items as we go along. There is a Q&A box down at the bottom of everybody's Zoom screen, so you can use that to type in your questions throughout. You don't have to wait till the end, but we will have all of our presenters present, and then we'll go through the questions at the end of the lecture, but also a few questions at the end of each of the presenters' lectures. So we have a lot of people joining us tonight. Welcome to everybody. Let's see, I just want to see where, yep, we're still, I think we're at a good, okay, so our first presenter tonight is Annette Hood. Annette is a clinical pharmacist specializing in women's oncology, including breast, ovarian, uterine, and cervical cancers on the main campus of Smilow Cancer Hospital in New Haven. She completed her Doctor of Pharmacy degree from the University of Connecticut and a residency at St. Francis Hospital and Medical Center in Hartford. Her main role is to review chemotherapy orders for all clinic patients, provide counseling to patients on chemotherapy and supportive care. She also works with Dr. Soffer, an integrative medicine clinic, to review supplements. So Annette, I'm going to have you start off.
Okay, let me share my screen. Let's see, actually. It's not the right screen. Hold on one second. Can you see presenter view, or are you seeing the entire slideshow view?
Yep, no, we're getting your presenter view.
You're just getting presenter view? Oh, okay, perfect. Okay. Just 1 second, too many screens here. Okay, great. Okay, so thank you for having me today on this very important talk about dietary supplements in cancer survivors. I know that this is a topic that many of you are very interested in, so I'm glad that you're here tonight. Tonight, I'm going to talk about some general information about supplements and their safety, and then debunk some myths surrounding dietary supplements. And then later on, Dr. Boyd is going to really get into more of the specifics on the safety and effectiveness of the dietary supplements. Oops, let's see. Okay. So first, let's talk about some background information on dietary supplements. So what are they? So these include our vitamins, which could be multivitamin products, which include, several different vitamins and minerals, or it could just include single vitamins such as vitamin A or vitamin D. It also includes minerals like calcium and herbs or botanicals. We can think of echinacea or valerian root as another example. And it also includes amino acids. So as the name suggests, dietary supplements really are intended to supplement the diet. They're not intended to diagnose any illnesses, to cure any illnesses or to treat or prevent a disease. And if the label of a certain product makes these claims, it's actually in violation of DSHEA, which is the Dietary Supplement Health and Education Act of 1994, which we'll talk a little bit more about in the next slide. So let's get into our first myth. So myth number one, supplements are regulated by the FDA just like other drugs. And actually, dietary supplements are regulated more as foods, not like the prescription medications or over-the-counter medications that we think about, where those manufacturers actually have to submit clinical trials proving the safety and efficacy of their product before it gets approved by the FDA and then before it comes to market. So any supplement that was already on the market prior to DSHEA, prior to 1994, is actually grandfathered in, and therefore does not have to prove to the FDA any safety or effectiveness before going to the market. So only once it's marketed, then the FDA has to actually prove that the product is not safe in order to restrict its use or remove it from the market. So what does the FDA actually regulate? It regulates the label. So as I had mentioned earlier, manufacturers of these supplements cannot make any claims related to treating or curing or preventing any illnesses. And if they do, then that is in violation of this act, and they could get either fines or have their product removed from the market. So because these products are not really strictly regulated by the FDA, there are some concerns about supplements, especially in terms of their quality. So some supplements may actually contain contaminants such as lead or arsenic, or they may have too much or too little of the ingredient that it says that is on the label. And some studies have actually found that more than 60% of supplements do not have what the label says that it has. So for example, this is a report to the right from a website called Consumer Lab, which I'll talk about a little bit more towards the end, which looks at products that are on the market and kind of tests them to see what's in the products. So they found that there's a 10-fold difference in potency across different types of ginseng products. So because these products aren't regulated, I will towards the end kind of give you some tips on what you can do to try to pick the safest products on the market. So let's get into myth number two. Dietary supplements are always safe. So many patients think that because something is natural, or either because it comes from a plant or an animal, that it is safe. However, a lot of these supplements are made into really concentrated formulations with high amounts of the specific supplement, and that will actually can make them unsafe. This is something that Dr. Boyd's going to spend a little bit more time talking about during his slides. So I wanted to give an example of something that, even though it's natural, it doesn't mean that it's safe. So here's an example of apricot kernel, or also known as apricot seeds, and it's marketed as vitamin B17. So as you can see, well, this is a pit that's found in the fruit of an apricot, in the center of the apricot fruit, sorry. So as you can see in the picture, it looks like an almond, and it even has the taste of an almond. And it's promoted as an anti-cancer agent, and it also is promoted to improve energy levels and well-being, and also as a detox for the body. So in actuality, there is no evidence to support that it can treat cancer. And vitamin B17 is actually amygdalin in this case, which is a toxic chemical that in the body is converted to the poison cyanide. And if you eat 50 to 60 of these apricot kernels, it can actually cause death. And at lower levels, cyanide poisoning can occur. So towards the right here is an article recently from Canada in which apricot kernels were being recalled over the risk of cyanide poisoning. So other signs of cyanide poisoning include weakness and confusion, anxiety, restlessness, and then in severe cases, seizures or death. So you can see on the label, it does give a warning that this product has sweet apricot kernels, which contain amygdalin, which can cause symptoms of cyanide poisoning, and to not eat more than 8 seeds. But you can see that someone who doesn't really know much about apricot kernels or who doesn't read the label may eat these just like regular nuts, which could lead to toxicity. So the main point about myth number 2 is that just because something is natural does not necessarily mean that it's safe. And this concept can apply to many other dietary supplements, depending on the dose that you're taking it at. I did also want to have you take a look at some labels of different supplements. These are actually multivitamins. So on the left here, you can see the list of the vitamins in this product, and then their percent of daily value. It's about 100% or less for each of these vitamins. And then the product in the middle with the yellow, if you take a look at these supplement facts, you can see that the thiamine in this product has 8,000% of your daily value, and vitamin B12 has 625% of your daily value. And then all the way to the right is just a single vitamin D product with 10,000 international units of vitamin D, which has 1,250% of your daily value.
Annette, I'm just going to interrupt you for 1 second.
Sure.
Your slide's not advancing.
Oh, I'm sorry. There you go.
Okay.
Okay, perfect. Okay, so I'll just briefly start over really quick. So to the left here, you can see the product that has the multivitamins listed at 100% or less of your daily value. In the middle is a product that has the higher amounts with the thiamine. You can see there at 8,000, B12 at 600. And then to the right is the vitamin D product with 1,250% of your daily value. So in general, I know a lot of people probably don't really look at the supplement facts and see what they're actually purchasing in their supplements that they're buying, but it's really important to really take a look and see what's in there. And just a tip is, if you're looking at these products, really try to stick to something that's at 100% of your daily value or less. Okay, so myth number 3, supplements do not interact with cancer treatments. Let me go back. So I know as cancer survivors, you have many different types of treatments, including radiation therapy and surgeries. Some of you may be on hormone supplements for hormone stimulating cancers like breast cancer or uterine cancer. And there are potential for interactions with supplements and these treatments as well. So I wanted to touch on these a little bit. Okay, so first let's talk about interactions with radiation therapy. So antioxidants, which neutralize reactive oxygen species or the free radicals that can cause cancer, patients use these to protect your normal tissue from treatment side effects. However, studies have found that the antioxidants may actually protect the cancer cells and interfere with the radiation treatment, or they may actually make the cancer cells grow more, which is something Dr. Boyd will touch on in his slides. So I wanted to give an example of vitamin E in radiation. Initial research had suggested that alpha tocopherol, which is a vitamin E compound, might reduce the toxicity from radiation therapy for head and neck cancers. But then 2 randomized controlled trials in head and neck cancer found that patients who were taking vitamin E at 400 international units per day, they were associated with a higher risk of tumor relapse and a decrease in cancer-free survival. So in general, the recommendation for patients getting radiation therapy is to avoid antioxidants, specifically vitamins A, C, and E. Other antioxidants include coenzyme Q10, selenium, and quercetin. And then in general, antioxidants that are found in food are safe unless you are using excessive amounts, such as if you're juicing fruits or vegetables. And this is something Dr. Soffer will go into more during his nutrition piece. Okay, so there are also potential interactions with surgery. Supplements such as ginkgo biloba, garlic, fish oil, green tea, and vitamin E all have an increased risk of bleeding. Supplements such as St. John's wort, valerian root, and kava, they all may have sedating or make you sleepy effects, which can prolong the effects of anesthesia. Other surgical complications that may come up, for example, ginseng may affect your blood sugar control before and after surgery, or may decrease the effectiveness of certain medications, such as a blood thinner called warfarin. So it's really important to discuss with all of your providers if you're taking any supplements, and particularly prior to surgery, your doctor may suggest that you stop any of these types of supplements 2 to 3 weeks prior to surgery. Some of you may be taking hormone therapies for your hormone sensitive conditions. As we mentioned, breast cancer or uterine or ovarian cancer. There are potential side effects potential interactions with supplements here as well. For example, St. John's wort really likes to chew up medications and get rid of them out of the body faster, and so can interfere with how tamoxifen works in your body and makes it work less effective. Other supplements may make hormone therapy more toxic or have more side effects. For example, tamoxifen is associated in rare cases with fatty liver or increased risks of liver toxicity. And if there's a supplement such as kava, which is also associated with liver toxicity, you may be at increased risk. Certain supplements such as ginseng contain chemicals that we call phytoestrogens that might act like estrogen and either potentiate the growth of these cancers or just interfere with the hormone therapy in general. So other examples that you should avoid in this case are resveratrol, soy supplements, and curcumin or turmeric, specifically the concentrated supplements, not necessarily the foods. Finally, I did want to touch on some interactions with chemotherapy. Antioxidants here as well. There have been data showing that they can neutralize the reactive oxygen species that chemotherapy agents may need to kill the cancer cells. Other supplements may interfere with the clearance of the chemotherapy, so they could either make it more toxic if it's not cleared properly, or can make it less effective if it's cleared too quickly. So finally, I just wanted to get into some resources and recommendations for you. In general, as I already mentioned, please discuss any supplements that you're taking with all of your providers throughout your treatment. In general, if you're eating a balanced diet, supplements probably aren't needed. Some patients may need them if they have low levels of certain vitamins or electrolytes, or maybe not be eating enough. So under the direction of a provider, may be instructed to take supplements. I've listed here a couple websites with some helpful information: the NIH Office of Dietary Supplements, the National Center for Complementary and Integrative Health, and Consumer Lab. And I'll go over each of these very briefly. So this is the website from the NIH Office of Dietary Supplements. And you can see they have an alphabetical list of vitamins and minerals, and also herbal products. You can click on any product that you want and read more about uses, safety. Some of these have specific doses listed, interactions, and other side effects. The National Center for Complementary and Integrative Health is focused less on vitamins and minerals and more on herbal products. So here's just a snapshot of some of the herbal products that they have on their website. And then finally, I wanted to touch on this website called Consumer Lab. Unfortunately, it does require a subscription, but they do have some really great information. So what they do is they actually go and they take products that are already on the market and they analyze them for contaminants. They analyze them to see if it actually has what it claims to have on the label in the amounts that it says on the label, and then it provides a report. So here is just a sample of a B vitamin supplement report that they had looked at. And so the last thing I wanted to touch on is, how do you know, or how can you pick the best supplement to ensure that it is as safe as possible? So I recommend that you pick supplements that are certified. So on the bottom here are different agencies that certify supplements. I usually prefer supplements that are USP certified. And on the right, you can see here an example of what it looks like on this Nature Made bottle. So what a certified supplement means is that it has been tested and proven to contain the ingredients that are listed on the label in the described amounts. It does not contain harmful levels of contaminants. The product will break down and release into the body within a specified amount of time. And it has been made according to the FDA Good Manufacturing Practices, which has safe and sanitary conditions, and that the supplement will be manufactured with consistent quality from batch to batch. So this is just a helpful tip on what to look for if you are going to purchase these products. That's all I had specifically for you on general background information. And at this point, I'll either take some questions or we'll save them to the end.
Yeah, we have here, I'll go into one question. We have a question. I'm craving oranges since starting chemo. How much is too much in terms of dietary vitamin C?
So dietary vitamin C, if you're eating if you're not taking a concentrated supplement of vitamin C, that's when it really becomes a concern. And you're eating a few oranges a day, that should be fine. I would say really it becomes a concern when you're starting to just take mega doses of these, like multiple glasses throughout the day, every single day.
All right. That was great. Thank you so much, Annette. So now we're going to continue on with our supplements and nutrition lecture with Dr. Barry Boyd. Dr. Boyd is an associate professor who cares for patients at the Smilow Cancer Care Center in Greenwich. He received his medical degree from Cornell University Medical College and a Master's of Science from Columbia Institute of Human Nutrition. He completed his residency and fellowship in hematology oncology at New York Hospital Cornell Medical Center. Dr. Boyd is a pioneer in the field of integrative cancer care with a targeted focus on nutritional support for cancer patients, incorporating emergent evidence-based medical oncology with cancer-specific nutritional counseling. He combines comprehensive support for the healing process. He authored The Missing Link, Insulin and Cancer, as well as numerous medical articles and reviews. His book, The Cancer Recovery Plan, was the first to address the link between the little understood metabolic syndrome and cancer. Dr. Boyd's research interests center on the interaction of vitamins and nutrients with chemotherapy, insulin resistance, and cancer causation and progression, and utility of non-conventional approaches, including mind-body techniques in combination with conventional cancer treatment. So thank you for joining us, Dr. Boyd.
Thank you, Heather. Do you both hear and see my presentation? We had that.
You, but you have to share your screen. So we're going to get you started. And just to let everybody know, we are recording this, so it will be available afterwards for you to view again if you need to. And we'll put some of the websites, Annette, if you can put some of those websites that you had in the chat, that would be great. So everybody can grab those through the chat as we go on.
Let me try to share my screen again. I thought I had. There we go. Got it?
Not yet. There you go.
Good. Let me do this one more time. Got my screen there, right?
We have your screen, yeah.
Good.
We don't have a presentation though.
You don't have my presentation?
No, we have your blank screen.
Ah. Seems like we've been through this road too many times.
Third time's the charm.
No luck?
Mm-mm.
Oh. Well, it says stop share, so that doesn't seem to be the correct on my other screen. Any luck there?
Not yet.
There?
Yeah, go down to the little PowerPoint button on the bottom of that screen and just pop open your PowerPoint tab at the bottom.
Yeah, no, I've just been doing that.
Mm.
Doesn't seem to want to open, even though it did before. Let me come out and go back in here. It's any luck now?
Yep, we can see it.
Okay, good. You can see it finally? Great. All right. They can see it. Fantastic. It always takes 10 or 15 minutes with this. You know, I'm at that age where I wasn't raised with a computer in my hand. I'm going to talk to you a little bit about the evolution of our understanding about cancer, dietary supplements, and nutrition. I've been in this work for almost 40 years. My colleague just retired, and I'm still at it because I love what I do. I will mention, as an aside, that Annette mentioned amygdalin. It may be known to you that that's actually called Laetrile in the alternative world. And it was so popular that in 1982, Charlie Mortel from Mayo Clinic had to do a randomized trial to see if there was any benefit because we knew it was potentially toxic. It did not help anyone, but it turned out there are still alternative physicians and practitioners who still give Laetrile to cancer patients despite the risk. So we're living in this world of false information still. I want to go back and talk about how this evolved. In the 60s and 70s, we knew that diet was associated with cancer and cardiovascular disease. We didn't know how. There's a lot of understanding about the role of dietary fruits and vegetables that seem to be associated with lower risk. And from this came the antioxidant hypothesis. Early on, it was recognized that oxidative stress will damage normal cells, DNA, membranes, and may be causal not only in cancer, but in heart disease. Oxidized LDL and its effect on cholesterol and atheromas. But this also was the era when we began to look at the idea of chemoprevention, the idea of using high-dose nutrients based on this hypothesis that we could actually prevent cancer. This has been profoundly beneficial in helping to educate us about misunderstandings about high-dose supplements. Unfortunately, people have never gotten this message. I have presented discussions about these trials that I call the landmark trials that nobody has ever heard of. Now, there is this persistent belief in the use of high-dose supplements. And again, we have to remember that they look nice and multicolored, but they're not the same thing as healthy fruits and vegetables. Back in the early 80s, two very prominent epidemiologists from England, Dahl and Peto, analyzed the causes of cancer in the US, and they analyzed that about 1/3 to 2/3 of all human cancers were caused by diet and lifestyle in a generic sense, okay? They didn't know what, but they felt that there was a clear association. I will say in 1995 to the year 2000, the principles and practice of oncology had lowered that to about 10%. Of course, that turns out that was wrong too. It still is substantial, but how? Well, what we knew was there was a very interesting beginning looking at a population in China, in Linhuan, China, that had an extremely high incidence of gastric cancer, surprisingly. And they thought because it was a very nutrient deficient population, there was concern that micronutrient deficiencies may have played a role. And so the US and the Academy of Medicine in Beijing decided to run a randomized trial of a number of different nutrients. And what they found was, again, micronutrient deficient, 30,000 patients in rural China. Now look at the risk, 10 times that of other provinces and 100 times the risk of gastric cancer in the US. Profoundly different population than us. And they looked at 4 different combinations and they found that beta carotene, vitamin E, and selenium, all in low doses of essentially replacing the daily requirement, not only lowered cancer mortality, but substantially lowered gastric cancer mortality. This persisted for the duration of the study, and then over time, the rates went back up to the baseline. But this became the birth of chemoprevention and became very exciting that you could use nutrients to prevent cancer. And therefore, this again, the origin of chemoprevention came from these early studies. The other thing was it was recognized that high dietary vegetables seem to be associated with lower lung cancer risk. Now, in smokers, high carcinogen exposure, and therefore maybe the antioxidant effect of vegetables and fruits may be potentially reducing risk. One of the nutrients looked at was beta carotene. And again, beta carotene is a carotenoid. It's one of 200 carotenoids, but it's the most common carotenoid in the carrots and the carotenoid containing vegetables, and is highly predictive of dietary intake of those nutrients. And low levels seem to be associated with lower cancer risk in smokers, and it's safe and non-toxic in high doses. And again, it's also readily available. So they elected to do a number of trials to try to use beta carotene to prevent lung cancer in smokers. The first one was so-called the ATBC trial. Now, this is Dahl and Pito again, with Michael Sporn and others who said, can we actually materially reduce human cancer rates by giving beta-carotene? And this was a very popular hypothesis. Even before we knew the results of this, I had patients taking beta-carotene themselves back in the early 80s. But what happened was this, the ATBC trial, this was in Finland, male smokers, and those who took beta-carotene, they compared beta-carotene, vitamin E, or the combination, or neither. And those who took beta-carotene actually had an 18% higher incidence of lung cancer. This was kind of a scary result. And at the same time, there was a trial being done in the US, and Yale was part of this, called the CARROT study. It was a vitamin A, retinol, or beta-carotene in smokers who also were exposed to asbestos. This population had an extremely high risk of lung cancer, and they said, can we actually lower the risk by giving beta-carotene? And when this result came out, the interim analysis of this study showed, lo and behold, beta-carotene increased the risk by 28%. Now, of course, the trouble was it didn't make any sense. Nobody understood why this high-dose supplement, again, it was in high doses, and I've calculated it's between 35 and 40 servings of fruits and vegetables every day, far higher than you can get in the normal diet. But for whatever reason, and we now have hypotheses that it actually enhanced the risk of developing cancer. From this, however, now look at this, Cancer Treatment Centers of America, I always love this, they actually, next to the cigarettes, they sell beta-carotene in their pharmacy. Hard to believe. And I actually spoke there and explained that this is not a safe supplement to recommend for patients. But from this, they also seem to show it was what we call a secondary endpoint, that maybe vitamin E might protect against prostate cancer. In addition to vitamin E, one of the other critical nutrients in antioxidants is selenium. And this is involved as a component of glutathione peroxidase. And we know that selenium seems to be associated with reduced cancer cell survival through animal studies. And geographic levels of selenium appear to correlate with the dietary intake based on where your fruits and vegetables are grown. The highest source of selenium turns out to be Brazil nuts. But people were using selenium because of this knowledge. And we knew also that there was apparent in low selenium levels a higher risk of cancer. So when they then went on to do a study to prevent prostate cancer using vitamin E, selenium, both are a placebo. And this was very exciting, and much like the beta-carotene studies, many of the men I knew were taking vitamin E and selenium, assuming the trial would turn out to be beneficial. And lo and behold, bang, it increased prostate cancer risk, the vitamin E, and the selenium increased diabetes risk. Again, totally unexpected, but lessons for us to try to retrospectively analyze and use the next trials to kind of help us understand this. Now, for one, when you look at the ATBC trial, the vitamin E levels correlate with mortality. Low vitamin E, higher mortality, but as you get higher, there's actually a higher mortality with increased levels of vitamin E in the serum. So there seemed to be what we would call a U-shaped curve. And then it turned out when they analyzed many studies of vitamin E, and you see here where that dotted red line is, that's the typical vitamin E capsule, 400 units. There is a distinct increase in mortality in all the trials analyzed. People taking vitamin E actually have a higher chance of dying. And the cut point for that was 180 IUs, 180 units of vitamin E daily. So there is, again, below that maybe a little benefit if you're low, but if you go up, there's an adverse risk. Again, by the way, nobody knows about this. Now, again, the average capsule size today at Kirkland's, at Costco, or you can go to GNC, or you can go to any of the stores, and it sells typically 400 IUs that is already known to be associated with increased mortality. And again, 1300% of your ADR. So anything we've learned from this? Well, what about selenium? Again, if you look at the levels of selenium sold, they're significantly above that of the daily requirement. Some people may need it if they're low, and they analyzed a skin cancer study and found that people who took the selenium in the trial for skin cancer prevention, who were low in selenium, had a decrease in cancer, but at baseline, those who had a high level of selenium had an increase in cancer risk. And the other thing is it was designed to prevent basal cell cancers, but it actually increased the risk of squamous cancers of the skin. So, dose makes the poison or the benefit. And again, and most people don't know that. So here's what they typically say, this is the sales pitch. Potent antioxidant, immune supporter, selenium has a wide variety of beneficial impacts on the body. Most importantly, like the other vitamins, it helps prevent cell damage from free radicals. Big mistake. Selenium has a U-shaped curve for mortality, just like vitamin E. This is NHANES, a national nutrition study that follows populations of the US over time. Anyone can access this population to do studies. Again, a U-shaped curve for selenium. Now, here's the problem. Deficiency, as I mentioned, there is an increased risk for multiple diseases. But on the other hand, too much selenium is also a problem. And I showed you already that it increases diabetic risk and may increase cancer risk when it's excessive in intake. And so to put together some of the data on multivitamins, Bajalovic and others looked at all the data on dietary supplements through almost 250,000 participants, the beta carotene, et cetera. And they found that overall antioxidants increases mortality. That's in general. These are in people who don't have cancer, who are taking it to prevent cancer and heart disease, and there is actually a higher risk of dying rather than doing better. So we must be careful. Now here's another B complex. One of my favorite talks, because it is considered by everybody safe at any speed. Therefore, whatever dose of B complex you take, it's water soluble, excreted, and therefore it's safe. Remember, when you take a nutrient, blood levels of that nutrient at very high doses remain high until you stop it. And then you, as they say, pee it out. So your cells are being exposed to extremely high levels of these nutrients until you stop the nutrient. So it may not be quite what you think it is. Well, Livestrong recommends B complex, helps your body convert calories into energy. What could be better? B100 contains most at high doses, right? 100 milligrams is well above the average daily requirement for most, but it's not stored and toxicity is not an issue. I am getting across the idea toxicity is not the only thing you need to be concerned about. Chronically elevated levels of these nutrients that are not toxic can have adverse risk. And B complex, as they say, converts food into energy. And, by the way, cancer loves energy. In fact, it's one of the biggest issues with tumor cells. It requires energy metabolism to grow efficiently. But they showed a very small study, showed an increase in vigor, improvements in mood with B complex. By the way, B vitamins are the greatest placebo known to man. B12, it has profoundly high placebo effect when people take it. They feel better. Now, these are the levels. Look at thiamine, over 6,000%. B6, 5,000%. B12 is not that high, actually, believe it or not. And I'll show you some others on that. So, but what's concerning, number one, B1 is critical for enzymes in tumor metabolism. Tumors need B vitamins as part of the metabolism of glucose into what's called 5' sugars to make the precursors for DNA and RNA, and also some of the NADH, some of the precursors for energy metabolism. And there is a concern that high levels of B1 may be playing a role in cancer because it's so widely used. By the way, nobody knows about these risks. We don't have enough data, but I am always concerned about people using extremely high doses. Worse than that, now here's an interesting study that came out of Norway where they don't supplement their diet with their breads and grains. And they looked at the question, what about using B vitamins, folic acid, B12, and B6 to prevent cancer? And what they found was that the combination of folic acid and B12 substantially increased lung cancer risk and lung cancer mortality. Wow. However, B6 appeared to be relatively safe, but it also increased risk in addition to hematologic cancers, but it was more so for lung. That's where the greatest risk was. cancer mortality and risk. Now, I don't think there are a lot of people who have ever heard about the Norvit and Wenbit study. Now, to make things much more disturbing, the largest group of institutions that follow large cohorts of patients throughout the US, Europe, and Asia, including the NIH, the NCI, Harvard, the Harvard School of Public Health, UCLA, University of Pittsburgh, Oxford, the European EPIC, the European Study Group, all pooled all of their patients' data that they were following and found that circulating B12 increased levels are positively associated with lung cancer, just like the trial I just showed you. More importantly, they did another test. They looked at the same number of patients within their cohorts and analyzed them for genes that were associated with higher B12 to try to control, is it the diet or is there something about B12 itself that's real? And genetically determined variants that are associated with higher B12 levels were consistently positively associated with overall lung cancer risk. And they said, based on the consistency of these two independent studies, the studies support the hypothesis that high B12 increases risk of lung cancer. Well, now here is a basic supplement of 5,000 micrograms. What's the amount? It's 208,000% of your daily requirement. No, it's not twice, it's not 5 times, it's 208,000%. This is where the supplement industry has gone with high dose supplements. Now it's completely out of control. This is a drug, ladies and gentlemen. This is not a supplement. And here are all the wonderful places you can get 5,000 micrograms. All over, multiple supplements. So this is, and these again are not regulated by the FDA. Now let's talk about vitamin D. This is isobars of UV exposure. The higher up you go in latitude, the greater the risk of breast cancer. You have the same curve for colon cancer. Unfortunately, if you look at the red, the highest areas are also the highest levels that are socioeconomically deprived, that have higher urban areas. So there may be other correlates to this, but you can see it's related to UV light. And that was sort of the evidence to support way back that there is a correlate between vitamin D and mortality. And cancer prevention. And so a number of trials and observational studies were done supporting this idea, but it wasn't really convincing. But people now believe vitamin D does prevent cancer. But is there proof of that? How strong is that? Well, this is early data that levels of vitamin D seem to be associated with survival in breast cancer. If you're deficient, you have a higher chance of potentially dying. And that's a different question. Can it change survival? This is a study looking at very high dose supplements to prevent cancer. And what they found, there was absolutely no effect on high dose vitamin D, a high dose monthly versus a placebo. It didn't seem over time to influence cancer risk. Then there was a very large VITAL study. This was a multi-center study with thousands of people enrolled in many centers, giving 2,000 IUs daily of vitamin D or a gram of omega-3 with a goal of determining whether it could reduce both cancer and heart disease. Now, in this study, no effects were shown for either, certainly for the omega-3, there was no effect on either cancer or heart disease. And vitamin D did not influence cancer risk. Now, they were at that point in the study fairly well nourished with vitamin D. There was a hint that vitamin D will improve survival, but not risk. And we're seeing the same thing, and Charlie Fuchs was with us at Yale and has now left, and their group at Harvard showed that in colon cancer patients, vitamin D levels do appear to correlate with improved colorectal survival. So higher levels are beneficial. We see the same thing again, but this is a U-shaped curve for vitamin D and survival with breast cancer. So there may be a point at which too much is not right. And again, very high dose vitamin D has more recently, in levels that we used to think were okay, been associated with higher levels of cancer, particularly GI cancers and pancreatic cancer. This is what's called a pooling cohort of rare cancers, and they found that high levels of vitamin D in the range that you can get easily through supplements doubled the risk of pancreatic cancer. And it turns out that there is a U-shaped curve for mortality and cancer. Too much vitamin D appears to be associated above 45 to 50 nanograms. This is an ongoing battle because there are true believers who think you need to be high. You don't. The data shows that if you're between 28 and 45 to 50 nanograms is the sweet spot for vitamin D. That can be achieved with 1,000 to 2,000 IUs a day of D3, not a higher dose. And you should not aim for high doses, but many people in the alternative and complementary field aim for levels of 60 to 100, which puts you in the upper range of that U-shaped curve toward mortality. Again, the U-shaped curve for mortality, and that shows you get to 60 and higher. Now, by the way, if you spend a lot of time out in the sun, you can't reach that level. You know, you can't reach above 60 if you spend 26 to 30 hours a week with sun exposure. Now, what about taking supplements if you're a cancer patient? Consume high levels, most common based on age, women, younger age, regional differences, and also correlates with higher levels of distress. And it may improve, the idea is, will it improve my quality of life, help my wellness, and improve survival? And are there risks and benefits? Well, there's a fascinating study that came out of a SWOG trial for breast cancer. It's called the DELCAP study, and they analyzed the use of dietary supplements in patients who are getting treated. And they asked, what is the effect? Now, I would go to the highlighted portions in the middle so we can skip for time purposes. Antioxidants increased progression and mortality by 1.4 times. And B12, we've heard this before, actually enhanced the risk of mortality and progression. Taking B12 as a single supplement, it doubled that risk. And we know for sure, we know iron's bad, and that was associated with risk, but multivitamins were not. So now we have more evidence to say maybe, you know, in the cancer population, we need to be much more cautious about this. Now, the problem is, and this was in 2013 in the Annals of Internal Medicine, it said, we should be careful, stop wasting your money on supplements. And they analyzed a number of randomized trials, but they missed something. There were two trials, the Physicians' Health Study and Suvamax, that in men showed a decrease in cancer incidence, but they weren't using high doses. They were supplementing them with a simple multivitamin, right? So what is the answer here? By the way, and I tell this to my colleagues, men don't eat their veggies. Dietary supplements in men who may not be careful about healthy, diverse diets and plant-based diets may benefit by a single multi-nutrient. This was Centrum. And in the Suvamax study was an alternative. This was not a very high dose, high potency vitamin. And here's the Suvamax data. I mean, yes, showing this significant increase in men, but not in women. Women have better diets. The US population, we know many people are actually micronutrient deficient, but you don't need high doses of supplements. That's the key here. And what about the antioxidants? Well, it turns out reactive oxygen species are critical signaling molecules that activate programmed cell death and cancer. And when you turn off that with antioxidants, tumors love that. People will use things like glutathione infusions. Big mistake, because glutathione inhibits the antioxidant, the oxidative stress that will kill tumor cells. They can't, because of the rapid tumor growth, cannot handle that. And yet here's the consequence. 60% continue to use supplements. It's a multi-billion-dollar industry. Most people are unaware of this, and they don't even know the dose of supplements they're taking. I've talked to patients, and they can't begin to tell me how much is in the nutrients they're taking. I asked them to turn it around. I went into Costco with my wife once, and I asked the person selling CoQ10, I showed her a bottle of B12, and I showed her the dose, and she looked at me, she said, "What are they doing? Why did they do that?" I said, "I don't know. You're the one that's selling these supplements." So these are the things I've learned. Respect the U-shaped curve. Toxicity is predictable and at high risk in very high doses. Too much vitamin D can cause kidney stones. Too much vitamin A can cause headaches and what's called normal pressure hydrocephalus and birth defects in children. But it's the adverse risk range. Beta carotene unexpectedly raises lung cancer risk in smokers. Folic acid, B12 unexpectedly seems to increase lung cancer risk itself. Low probability, but not zero. Too much vitamin D, twice the risk of pancreatic cancer. And the other issue is the law of unintended consequences. It's not predictable until you do these studies, and then you retrospectively figure out what is it. Beta carotene turns on cell proliferation. It's a gene regulator, not just an antioxidant. And always respect nature. We are using nutrients at levels that are incapable of being reached in nature. And lastly, the economic law. Patients who take it don't need it, and people who need it don't take it. They target people who are well and healthy with very high dose nutrients. The higher the better, and people are not aware of that. So here's the conclusion. There's no consistent evidence to support the general use of supplements in the general population for prevention. Correcting deficiency may reduce risk, but high-dose nutrient supplements in healthy, non-deficient individuals may actually increase risk. Remember the U-shaped curve. Know what you are taking. The majority of the public continue to consume levels of nutrients in levels and they are completely unaware of this risk. I gave this talk to a group of fellows in radiation therapy at Yale, and none of them have heard of these studies. Doctors don't know about this, because they're not educated in nutrition. It is very prudent to recommend consumption of micronutrient-dense foods for chronic disease prevention, maintain healthy weight, and stay physically active. So again, this is common sense, and I will leave it at that and open it for questions.
Great, thank you. Dr. Boyd, just stop your screen share. So
Sure
I'm going to just go to two quick questions here. We have a question about, was there a control on their diets? Referring to some.
On whose side?
They could have a huge variation in the vitamins consumed in their diets.
Oh, well, you're talking about the DELCAP study?
I think so. She wasn't specific.
They correct for that. So one of the ways, and it's always an issue, and I did mention that in the B12 study, to correct for confounding, which is what you're talking about, something else that may actually explain it, they use this, we call that Mendelian randomization, using genetic markers that are correlated with higher levels to eliminate the idea that it was something else. Is it really related? Not only was B12 related to lung cancer risk, it was also a similar Mendelian randomization study showed the same thing with colon cancer. So I think, yes, you could argue maybe it was something else, but taking B12 is at very, very, very high doses is very easy. I've had patients who take upwards of twice that level. That is, they're taking over 400,000% of their daily requirement. And you won't feel anything until your cancer progresses. And this is one of the dilemmas. You don't need it. That's the point. You may need more because of issues of absorption, but nobody needs 400,000% or 200,000% or 100,000%. It's insanity, personally.
Okay, thank you. That's so much information, and we will get to some of these questions after we hear from Dr. Gary Soffer. Dr. Gary Soffer specializes in pediatric allergy, immunology, and integrative medicine at Yale School of Medicine. He completed a degree in human development at Cornell University and received his medical degree at Tel Aviv University in Israel. He attended the University of Arizona Andrew Weil Center for Integrative Medicine and received certifications in mindfulness meditation. He has interests in food allergies, mind-body medicine, eczema, asthma, and environmental allergies. He is also the director of the Smilow Cancer Center Hospital Integrative Medicine Program. So welcome, Dr. Soffer.
Thank you. Let's see if I can get my share screen right. All right, I'm going to warn all of you, 8 p.m. is the time that you might get toddlers bursting into my room, and I will apologize now if that happens, but I will pause to give them a kiss if they do. So can you see my slides? Does that look okay? Great, fantastic. All right, So survivorship, myth busting, diet, nutrition. First, let me say what wonderful talks just happened right before me. I learned so much from Dr. Boyd and from Annette, and I hope you guys did too as well. But we're going to talk about diet and nutrition as a means of obtaining these vitamins and these nutrients that you're looking for. So let's get into it. So number one myth is this is food. It might look like food, it might smell like food, it might taste like food, but it's not food. When we think about survivorship, when we think about giving our body the nutrients and the health and sustaining it and moving it in the right direction. So really think about what you're eating with processed foods. And so let's go through some basic rules that I think about when I think about nutrition. So rule number one, if your grandmother wouldn't recognize it as food, it's probably not food. And I've had to adjust this to great grandmother as time goes on. But the simple principle here is if you put a Twinkie in front of your great grandmother, she'd probably stare at it for 30 minutes, having no idea what to do with it. So think about the food that you're eating. Rule number two, if you can't pronounce the ingredients, it probably isn't food either. There are exceptions, tomato and tomato, and I still think it's quinoa, but I'm not entirely sure. So rule number three, the closer it is to the earth, the better it is for you. And we're going to dive a little bit into soy later, but soy is a great example of how food can go wrong. So if you look all the way to the left, we're looking at edamame. This is the most natural source of soy, right? Straight from the plant, from the bean. And you shift a little bit to the right, and we have tempeh and miso, slightly processed, but really good foods because they include fermentation, they include natural probiotics. And then we move a little to the right, and we have tofu. Now, tofu is good, but it's not as good as the edamame. But if we move all the way to the right, that's where we start getting into trouble. That's where we have our highly processed soy foods. So when you think about what you're putting into your body, I want you to consider how close to the plant, the original plant, this was. Because when we look at our tofu dogs and our tofurkey and our soy patties, those contain so much sodium, so much additives, dyes, and everything else that moves it away from being natural and good for you. So I'm going to steal this quote. I stole this quote from Michael Pollan. If you haven't read Michael Pollan's books on plants and agriculture, I would really, really recommend it. But what he says is eat food, not too much, and mostly plants. Those are the basic principles, but let's get back to the myths. And so here's another myth. This is a superfood. And I'm not picking on breadfruit in particular. I've never tried breadfruit. I'm sure it's delicious. But identifying one single food as a superfood is always a mistake. So really, what is superfood? Superfood is a nutritious diet. It's a well-balanced and robust diet. And so to the right, what you see is the anti-inflammatory pyramid. And it shouldn't be a surprise that at the bottom of this pyramid, where you should be getting most of your food, most of your nutrients, is fruits and vegetables and healthy servings of water. Moving up, thinking about whole grains and cereal grains, and even pasta once in a while. Beans are great, legumes are great. And then we move up to healthy fats. We're going to talk about fat in a second. Soy foods, we'll talk about soy foods. And then moving up less and less, fish is great. And then tea. Healthy spices, this really shouldn't be at the top because you guys can have as much healthy spices as you want as long as you're adding it to your food. So load up on the spices, choose organic foods when possible, and wash your produce to really minimize the pesticide exposure. Increase fiber intake, limit red meat, and then try to get fish into your diet. And so let's talk about fat, because there's a claim that fat is inflammatory. It can be bad. We heard about fat-free diets, and we have essential fats that we need to get in our diet that we can't make for ourselves. And the ones that we think about the most are omega-6 and omega-3. And it's really about maintaining a healthy ratio. So the healthy goal and what's been shown to decrease cancer risk is an omega-6 to omega-3 ratio of about 2 to 1 or even 1 to 1. The standard American diet, which we shortened to SAD appropriately, is about 14 to 1. So we're completely off. So it's no wonder that we have increased cancer in the United States. And so what I like to see my patients do is eating more omega-3 fats, things like wild caught fish, so sardines or tuna or herring, and wild caught salmons, or avocados and olives, or tree nuts. We love tree nuts. And then really, there's a lot of talk about meat, but certain grass-fed meat actually has higher omega-3 ratio in it. That's opposed to factory farm meat, which has a higher omega-6 ratio. Other things like fried foods contain omega-6s. So it's really easy to eat your omega-6s because you're enjoying them. Those are the foods that, we're built to love for some reason. But I always want to see my patients shift over to more omega-3s in their diet. So myth, is this a myth? I don't know if it's a myth. And I think we're still discovering it and trying to understand it in the science. But the myth is that cancer loves sugar. Again, I don't know. And the claim is that cancer consumes sugar quickly to help it grow. And what I really recommend for people is that you consider the type of sugar that you're consuming, okay? If this is added sugar, if this is highly refined sugar versus sugar that's coming from fruits and vegetables, I say stick to the fruits and vegetables. I just don't want you to be deceived when you see cane sugar on something. That's still an added sugar. That's still a refined sugar, even though it sounds like it's plant-based. So keep the fruits and vegetables in your diet, but really try to remove those processed foods with the added sugars. The other thing I want you to always consider is the glycemic index of foods. So certain foods are absorbed differently in the body. So white potatoes, for example, have a very high glycemic index. Our body absorbs that sugar very quickly. Sweet potatoes, surprisingly, actually have a low glycemic index, meaning that our body absorbs it slowly and can handle it differently. I'm not going to dive too deep into it, but it's worth looking into the glycemic index of foods. So the next myth, if it says it's healthy and natural, it's good for you. And that's just not necessarily the case. Dr. Boyd did such a good job of describing supplements and how they seem like they're natural and good for you, but how dangerous they can be. And the two foods that I always see patients show up with saying they're eating a healthy diet are granola and oatmeal. And so this is an average granola nutritional facts, pretty representative of most of what's out there. And if you can see, I know it's small, but this granola has 17 grams of sugar. So in this 2/3 of a cup, you're eating 1/3 of your recommended sugar intake for the day. Oatmeal, flavored oatmeal packets. We think we're eating healthy because it says apple flavored on it. But really, look at the nutrition facts. 13 grams of sugar, 260 milligrams of sodium. So high in sodium, high in sugar. So even though it sounds natural and healthy, you really want to get into the habit of reading ingredients. Myth, I need to get my vitamins from my supplements. We just had 2 speakers do such a wonderful job of describing and explaining why this isn't necessary. Annette, myself, and Maura Harrigan, who's a registered dietitian, wrote an article about the 9 most essential vitamins you need in your diet and how to get them into your diet, how to find them in your food. And so look up the article and give it a read. But I know we're going to disagree. I know certain patients are going to feel strongly about taking their vitamins, and every patient should have a right to manage their own care with the best of advice that we can give them. And so what Annette and I have is we've created a supplements clinic for our patients to come in and really ask about the vitamins and the supplements they're taking so we can deep dive. We want to make sure they're safe. We want to make sure they're not interacting with your medications and that you're getting the correct dosing and that you're using a reputable source. And then we want you to consider dietary sources for them, because I think we all believe that that's the best way to get your supplements. And I'll just add this caveat because most patients who come to see me hear this. Most supplements are derived from diet. At no point in these thousands of years of tradition that made healthy diets was this ever intended to be in a veggie capsule. So I really want you to think about getting these supplements in your food. Here's another myth that might surprise you. Everything needs to be organic. Yes, organic's really good for you. And there was a study in France of 70,000 people, and it seemed that those who were consuming organic food had a much lower risk, even 25% lower risk of developing cancer. Now, that being said, the way marketing is designed in this country, you have to consider what organic really means. And organic doesn't always mean healthy. And I put Kraft macaroni cheese up here because it might be organic, but that's not what I want you eating in your diet. I'd rather you eat a conventionally grown apple than organic Kraft macaroni and cheese. But try to buy organic when you can, and buy local, buy seasonal, buy fresh. Keep in mind that getting the organic label is really quite expensive for certain farmers, and they may be practicing organic, but they may not be able to afford the actual label. So talk to your farmers, go to your farmers markets and interact with them. The next myth is alkaline water or even alkaline food will help prevent cancer. And so the claim is that cancer thrives in more acidic environments, and drinking alkaline water or eating alkaline foods will help prevent that, right? Keeping that acid-base balance. There's really no evidence to support that the use of alkaline water or foods is going to prevent cancer. And most of the research claims that are quoted really happened in a laboratory setting and not in humans. So in petri dishes or even maybe in animals, but never in humans. It's never been shown. The fact of the matter is that our human physiology, our liver, our kidneys, our lungs are really good at maintaining an acid-base balance. And so by the time you absorb that alkaline water, your body's already readjusted. It's important to also know that excessive intake of it can have some side effects. So alkaline likes to leach calcium, and it can do so from the bone and possibly create bone issues. Okay, so this is the worst news of all, is the myth that drinking wine is good for me. And the truth is, it's really not. The thought is that red wine contains high levels of resveratrol, which is good for the body. And that's true with respect to cardiovascular health, but hasn't really been shown for cancer outcomes. In fact, alcohol intake may increase your risk for cancer. So if you're interested in getting resveratrol, there's other great sources for it. Grapes in their natural form before they were allowed to ferment, blueberries, and even cocoa. Now, if drinking, because it's really tough to completely eliminate drinking from your diet, the recommendations that I would make are thinking about drinking red wine over white wine, because red wine does contain more resveratrol. Being mindful of the vineyard that you're buying from. So think about the practices and the location of the vineyard. And then really try to limit your intake to about 5 ounces. So another myth is that soy is bad for you. And the theory is, and this is particularly with estrogen sensitive cancers, is that soy may mimic or block estrogens. But in large population studies where they take large groups of people, they've actually shown no increased risk and potential and show potential for greater survival. It's a great source of fiber, it's a great source of protein, and it's a great source of what we call phytochemicals, or chemicals that come from plants. Back to the point I was making before, isoflavones, which are really one of the most wonderful phytochemical in soy, are present more in miso than they are in tofu. And so if I didn't give you reassurance, the American Institute of Cancer Research has a whole list of foods that fight cancer, and soy is on it. So a moderate amount of whole soy foods, 1 to 2 servings a day, is safe, and it's likely helpful too. Again, thinking about where you're getting your soy, not soy patties. So there's a thought that raw food might be better, and the claim is that cooking destroys these vital enzymes. And the truth is that some food actually requires cooking to release phytochemicals. So one of the best examples is lycopene in tomatoes. Cooking your tomatoes is going to release lycopene, which has been associated with decreased prostate cancer. Carotenoids and carrots, you need to cook the carrots to get the carotenoids out. Some food also has toxins if uncooked. Now, I never really recommend button mushrooms to my patients because I don't think they have that much benefit, but all mushrooms have carcinogens in them if they're uncooked. So look out for the maitake, the shiitake, those cooked Asian mushrooms. Those have a lot of great properties to them, a lot of great benefits to them, and start cooking them in stews and in your diet. The next myth is that you can't cook. And so these are some really nice books that I recommend. The Anti-Inflammatory Family Cookbook is really focused on children and family diet. The One Pot Vegetarian, I really like. It's a plant-based cookbook. It has a lot of very easy, basic recipes. Anything by Rebecca Katz over here. She's written a number of really good books, and I think The Cancer Fighting Kitchen is one of the best ones. And then Fast Food, Good Food by Andrew Weil, who's one of my mentors. And we're getting to the end, and I want you to remember that diet isn't everything, okay? There's so much more to your survivorship that you need to consider and you need to nurture and you need to take care of. You have to think about physical activity, your psychological health and well-being, your spiritual health. We don't talk about this enough in medicine, is the need for spiritual fulfillment in the survivorship period, mind-body activities, and then just remembering things are well beyond our control. And the final myth is that you should go at this alone. We have a number of really good resources through survivorship and through the integrative medicine program, and we're here to support you and help you, and no question is too small. And anything that you're curious about deserves, the respect and the thoughtfulness to answer it. So thank you so much. It was an honor to get to speak with Dr. Boyd and with Annette, and I look forward to any questions you guys have.
Thank you, Dr. Soffer. That was wonderful. And your talk actually answered quite a few questions that came up in our chat already. But I will go through them. We have a few. Thank you, everybody, for sticking around. I know we're moving along here. So let's start out with somebody was wondering about the use of essential oils for side effects of chemotherapy. Any knowledge on that? Anybody on this panel?
There is one, and I think it's a really important example of the law of unintended consequences. And I've talked to others about this. A group of researchers from the Netherlands looked at the use of high levels of omega-3 fatty acids in the presence of certain chemotherapy, particularly platinum-based chemotherapy. Now, when you consume omega-3 fats, they get incorporated, these oils get incorporated into basement membranes. And what they found was, not only in the tumor, but in the tumor microenvironment cells. And what they found was that when you do that and you treat with platinum-based chemotherapy, it cleaves a molecule from the omega-3 in those cells, in the environment, microenvironment, and it inhibits chemotherapy response. It's pretty consistent. And then they analyzed the levels of omega-3. So they cautioned, this was in JAMA Oncology 2 years ago, and there are several articles that have looked at this, and the argument being, if you're on a platinum-based chemotherapy, be careful about high levels of omega-3 around that time. Everybody raises their eyebrows because everybody assumes that omega-3 is safe. But this is another example. There's more than we realize in the biology of these nutrients. When you take high levels, you're incorporating those into the cells. Now remember, the VITAL study showed no benefit for omega-3 in either cancer or heart disease, right? So this is still a huge assumption. Even survivorship and use of omega-3s to prevent cancer weight loss has not been proven to be correct. It is one of those foods that everybody assumes is really healthy. Sorry, I'm looking at and yet the evidence, I tell my patients, if they're on a platinum-based chemotherapy for around the week that they're on it, don't have high levels of omega-3. I mean, because we need to understand, they're very adamant. They recommended in the JAMA article to be very careful about taking it because we never recognize this potential adverse effect. Never mind the bleeding and the other risks that can happen with high doses of omega-3 fish oil. Any other comments, Gary? I don't know if you're.
Yeah, no, so I want to just distinguish because I'm not sure if the individual is asking about essential fatty acids or essential oils.
Right. No, I agree. Right.
And so if we're talking about essential oils, I think essential oils are generally safe if taken as an inhalation.
Right.
Certain ones like camphor, eucalyptus can actually lower seizure thresholds. So I'm pretty careful with any of my patients who have a risk for seizure and recommending them. But besides that, things like lavender used as an inhalant can be quite safe and relaxing.
Right.
Great, thank you. Is magnesium safe?
I would say if taken at the recommended daily values, as we discussed, some patients may be magnesium deficient, so definitely they should be taking a magnesium supplement as well.
Great.
Many
How
of the
about
chemotherapies can actually induce magnesium loss, and that can lead to issues with vitamin D efficacy, et cetera. So, generally, we probably, if you look at national data, magnesium deficiency is far more common than we realize. But you don't want a lot, like everything. If you need it, you should find out where it is to have adequate supplementation if you need it.
So I use some doses of magnesium to help patients with sleep. I find it helpful in those cases, and I'll also use it for constipation as well, because that can be a side effect. So yes, if taken in the right doses while discussing it with your physician, it can certainly be safe.
Great.
And then also keeping in mind magnesium-rich foods, okay? So foods like black beans have lots of magnesium in them. So getting those legumes into your diet and thinking about getting it that way.
Good point. We have a couple questions about, are there any books about cancer and nutrition, which you nicely had a great slide with many book options on there. We will also, again, if, we have some resources after that'll be available to you on our yalecancercenter.org/survivorship website, which we'll post that at the end too. Let's see, how about, we answered a sugar question that was answered in your lecture. What nutrients,
Can I
Dr.
address that, by the
Soffer?
way?
Yeah.
Yeah, because I think, and I gave this talk 2 weeks ago at Yale, one of the things we're learning, and Walter Willett is described as he called the fourth paradigm, vegetables and fruits, dietary carcinogens, even dietary vegetables, if you look at across the board, the link with cancer is far less than we realize. Having a healthy plant-based diet is clearly the best. But within populations, levels of fruits and vegetables, the Eskimos had low cancer risk until they moved to Saskatchewan. But what I was going to get at is metabolism and your metabolic status and weight determine how you handle complex concentrated carbohydrates. And so for some people, high levels of sugars and concentrated carbohydrates are really dangerous. And Harvard just came out with a fascinating study that's not yet published, where they looked at the use of, quote, diabetic type diets, and not for diabetes, but people were following diets that you would use. High fruits and vegetables, avoiding high concentrated carbohydrates and high levels of sugar sweetened beverages, coffee, which is beneficial, high levels of nuts and nut intake, reduced levels of saturated fat, and avoiding high glycemic foods, all the things we've talked about, showed a 25% reduction in cancer progression in women being followed with breast cancer. So it seemed to be potentially, and again, it's an observational study, but they were very careful to look at this. And it argues about diets that are designed to lower insulin level, which is my thing, insulin resistance, which activates tumor growth. And it does sort of contain kind of nuggets of truth about all of these components of diet that may actually benefit long-term survival in cancer patients.
I'm on mute. What vitamins give you energy? That you can get
So
from
So I love recommending green tea. And the reason I love recommending green tea, and you shouldn't take it in mass quantities, but not only green tea has caffeine in it, but it also has certain phytochemicals that ease and calm the nerves as well. So it creates a really nice balance between an energetic boost and not getting the shakes that coffee might give you.
How about biotin? Is biotin safe?
Believe it or not, in moderate doses, it appears to be safe. You know, unfortunately, it's one of those nutrients that people love to take for their hair and nails. And clearly it does maybe help to some degree, but I think overusing it is again a nutrient. But it doesn't share the same features of B12, for instance, which is necessary for DNA synthesis and cell growth. You know, it doesn't have those same features. But again, don't take too much.
Right. And what's an ideal amount of daily protein consumption for men?
Depends on your age. You know, 0.8 grams per kilo, there's some calculations, but if you're over 65, the level of protein intake needs to be higher to maintain adequate muscle synthesis. They've shown that we become less efficient at muscle protein synthesis as we get older. And so there've been guidelines that say we need to go up. And also, if people are chronically ill, we need to maintain adequate levels of protein, because one of the worst things that can happen is weight loss and sarcopenia. That is, loss of muscle mass is a major cause of toxicity and impaired survival and poor quality of life. So dietary protein is important in those populations and patients who have cancer. But if you're older, you're less efficient, so you may need less. And by the way, we probably get too much protein when we're young. You know, we're really enriched in protein, and they've shown that in babies who have twice as much protein in formula as they do in mother's milk, they have a higher incidence of obesity, and they actually lower the protein level in the formula, and they reduce the obesity in children in multiple centers in Europe. So, you know, we load up protein, but you may not need that much. Gary, any thoughts about that?
No, I think you covered it beautifully.
But plant-based protein is healthier than animal-based protein. A number of studies have shown that. High animal-based protein, higher mortality in low-carb diets with high protein, higher plant-based protein with low-carb diets, less mortality. So plant-based still is the best within the balance of my macronutrients.
Great. We have a question about, lost it on this scrolling here. Dr. Soffer, what nutrients do you find to be the hardest to get from diet alone?
I would say vitamin D is probably the toughest to get in your diet alone.
Okay. And are there, yeah, easy. Are there any good and reliable websites to find out about the benefits and risks of various Chinese medicines? I lived in China for 20 plus years, and my wife is from there. She often encourages me to eat sea cucumbers and caterpillar fungus, which are supposedly good for preventing cancer. But after hearing tonight's presentations, I wonder if there are any true and clinically proven benefits or potential risks in eating these foods in large amounts.
So I think what we find with herbs from China, unfortunately, is as poorly regulated supplements are here, they're quite poorly regulated over there. Time and time again, studies have shown that they've been adulterated with other products. You know, the most famous and probably the most humorous is male Chinese herbs coming over and turning out to be just adulterated with Viagra. So yeah, I think I would use a lot of caution. That being said, there's a lot of promise with Chinese herbs, and there's a lot of research going into it. But I would say the best, one of my favorite resources that's freely available for everybody is Memorial Sloan Kettering has a website called About Herbs that is a great resource and covers a huge amount herbs and supplements and discusses their safety and risks.
Great. Here's one about the green tea that you mentioned. Is that amount of caffeine okay on a daily basis? A cup a day. I was told no caffeine post-surgery, but I miss the green tea.
Everybody metabolizes caffeine differently. You know, I think you have to use your own judgment. I wouldn't go past a cup or two during the day, but it should be generally safe. I would talk to your physician about it because I don't know your individual circumstance, and I would trust your physician and their recommendations though.
Great.
I also wanted to mention there's a lot of green tea supplements out there as well. I would probably try to stick with the green, just actually the green tea itself, not a concentrated like green tea supplement or EGCG, something like that. The green tea itself is in small amounts would be okay.
Absolutely, those supplements can cause liver damage, and we've seen it. It's not theoretical, so it's a great point. Heather, you're muted.
Yes, muted again. We have one here about CBD. I have frequent issues with waking in the middle of the night and up for hours, very tired the next day due to interrupted sleep. Took a trial dose of CBD, 30 milligrams. Maybe it was too low, wasn't helpful. Any suggestions regarding the dose or other supplements to help sleep?
So my first suggestion here is always making patients aware that waking up in the middle of the night is completely normal. It happens to everybody. And some people don't realize it, that they're waking up, but everybody wakes up. And I have to tell you from my own personal experience, I was somebody who would wake up in the middle of the night and my mind would just start racing. I'm never gonna fall asleep. I'm gonna be tired in the morning. This is gonna ruin my day, yada, yada, yada. Just somebody telling me that fact alone allowed me to go to sleep much more easily. Now, if it's still an issue for you after you know that, the thing that I've actually found the most useful for patients having difficulty falling asleep is something called Sleep Stories. It's an app, it's on the Calm app. It's a 7-day free trial, so you can give it a shot. They are really, really boring stories. And I've used it myself, and it's really helpful to fall asleep. Give that a shot first before anything else.
I love that. I'm going to try it myself.
Yeah, try it.
Can you share your thoughts on the Gerson therapy? Anybody familiar with that?
Yeah.
Dr. Boyd, do you want to take this one? I suspect you've seen this more than I have, but I'm happy to talk about it too.
I have a lot of patients who use many of these alternative dietary programs. They're promoted, and they vary in what they, natural supplements, natural foods, high juices, and the Gerson is a multiple dietary approach. And a lot of people follow that, but the dilemma with this is, number one, people will often use it in lieu of conventional therapy, which is dangerous. And number two, there's really no evidence that any of these have substantial benefit. I mean, we see this all the time. This is a very big dilemma in the world of conventional and alternative therapy. So, I mean, that's one of many different diets out there. Gary mentioned the alkaline diet, and that's, again, very common. I mean, as a popular approach that has not been shown to be, you pee out the alkali, that's why it shows up in the urine. That's the body's way of controlling pH.
Okay.
So I will say the American Cancer Society recommends strongly against the Gerson diet. It can cause actual nutritional deficiencies because of what it is. I don't like juicing because you're taking away so much of the fiber and so much of what makes fruit good for you that you're really missing out on a lot of it. There's also a component in the Gerson diet, which I strongly recommend against, which is coffee enemas. These coffee enemas have really caused a lot of harm with patients, really quite dangerous.
Great information. So we're going to go through 2 more of our questions, and then we will answer some of these questions offline after. I don't want to take up too much more time here, but we've got a few more left, and then we'll log off, and we'll have to have another part 2 of this series because the questions and the information just keep coming, and it's really wonderful. So would it be beneficial to cancer patients and survivors to have periodic blood work to look at the levels of minerals or vitamins to see if supplements are needed or should be eliminated?
So for us as doctors, lab tests, it's very important that they're validated and their use is validated. And so a healthy person should really maintain a good amount of nutrients and nutrient levels. A lot of the labs that get sent by other practitioners, by alternative practitioners, are not validated studies, meaning that I might go in on a Monday at 1 p.m. and my levels might show one thing, and I might go in at 3 p.m. and my levels might show another thing. I've actually seen that quite a bit with patients. So it's important that, you know, any labs that are being sent are validated. I think checking vitamin D can be a really helpful thing to look at, but beyond what your oncologist is sending out as a standard baseline, I don't think you need much beyond that.
Yeah, I would agree. I sometimes, in patients using high doses, and I've found this repeatedly, people taking those very high doses of B12, they'll have levels that are 1,000, 2,000 microgram, you know, above what they want. And so it shows them that it's too much. Vitamin D again, but not all the time. And I often will do it seasonally if they're on supplements. And most of my patients will take between 1,000 and 2,000 a day because of the data on survival. And Gary, I agree 100%. One of the biggest problems is patients go to many, many different specialists in nutrition who are using non-validated tests, often linked to the use of supplements. It's a way, and the supplements, of course, are sold at profit. And so it's a way of getting them into a system, and the patients feel like they're getting nutrition advice that the doctor or the oncologist are not giving them. And so that's why it's important for all of us to provide that in a reasonable and scientifically based approach, so that they're not going to people who provide these, non-valid tests and inappropriate levels of nutrients and nutrition. They often don't even talk about nutrition. They talk more about the supplements.
Absolutely.
Annette, we have a question for you. Is adrenatone safe?
I actually have not heard of adrenatone. If it's type of adrenaline or ephedra or of some type, I'm not sure. But if that is the case, then I would probably avoid those types of supplements. There's a lot of cardiac concerns with those types of supplements.
Okay.
The other thing I'll add is, and there's so many supplements with so many funny names, and they're hard to keep track of. Some of the ones with adrenaline in it can actually have steroids in it and cause adrenal suppression. So I've seen it clinically, I've seen it in practice. So I'd be very, very careful with supplements like that.
And we have a final two questions. Any thoughts about low dosing melatonin?
So I think melatonin can be helpful for certain situations, and I think it's probably safe. I think it is safe. I'll say that. The only thing that people make the greatest mistake of is they take melatonin when they can't sleep. You really need to take melatonin a few hours beforehand to really get the full effect and to put you into sleep.
That's great advice. How about
better to set your clock when you've traveled and repeated doses stop working.
right?
And interestingly, there's a group in Italy, Lissani and others, who have shown the synergy between melatonin and tamoxifen and endocrine therapy, but not in big trials, but it's sort of been intriguing about.
And a quick opinion on intermittent fasting during chemo treatments. I can.
So
Caution, I do a lot of this. This is what I deal with every day. People need to be careful. I have patients who want to do this. They don't know that this is Walter Longo in his work at USC, who's looked at, it seems to suppress the chemo side effects in normal tissues. There has been a concern that it may also suppress the efficacy of chemotherapy. In one of his animal models, it showed that the animals that didn't die from chemo, who were on a low dose fasting before chemo, they actually survived the chemo, but they died faster than the others that didn't get the fasting. So we have to be careful. It's really, and you don't want to lose weight. That's one of the dilemmas with this, and become hypoglycemic. So it's a work in progress. I wouldn't recommend it. These are things that need to be studied, not promoted without good research.
I think it's also important to point out that, we use the term cancer, but every cancer is different.
Right.
And so when we're researching supplements or we're researching certain things, we're looking at specific types of cancers. And so you really have to get granular. You have to get nuanced about this, and you can't look at it so broadly.
Yeah, as an example of that, I've been looking at the use of very high dose vitamin C in pancreatic cancer. There are subtypes of pancreatic cancer, Lucan Lee at Cornell has shown this, that have certain mutations that seem to have efficacy, and he's still interested in this, but many cancers that are slow growing, it has no effect at all.
Okay, so for our last question, should you take a daily multivitamin if you're on a plant-based diet and currently in good health as a survivor?
I would say it's not unsafe to take a daily multivitamin. If you are getting an adequate diet, maybe you don't even need it, but it's not unsafe. So it would be okay to take.
Yeah, and I will tell you that all of the studies, including the Women's Health Initiative and cancer survivors, have shown, I mentioned that in the DELCAP study, but it turns out that in the Women's Health Initiative and Rowan Chablowski and all the studies show there seems to be a potential benefit by taking a daily multivitamin, but not a lot. However, you don't want to be taking iron. Big deal. In Iowa Women's study, there was increased mortality in women taking supplemental iron. It's enhanced mortality. And of course, they didn't need it, but they were still on it after menopause. So you have to be really careful about what you're taking, but it's healthy. You may not need it, but if you're not sure, it's not probably going to have any risk. But you don't want to have this high potency multivitamin. That's the risk.
Okay, so I think we're going to wrap it up for this evening. We have had so many great questions, and we will respond back to anybody's questions that we did not get to via email. We also encourage you to email us any more questions that you have, and we will get the right person to answer your emails. So the email address to answer us any more questions would be canceranswers@yale.edu. So it's cancer answer plural, canceranswers@yale.edu. And I just want to thank our presenters tonight for taking the time to be with us and really give all of your expert opinions and information, expertise in this, and really just sharing your time with us tonight. And for everybody who stuck around and stayed with us tonight, it was great. This was such great information and such a great success. It's so much fun and great to be able to have a part 2 when we have time. So thank you, everyone. And stay tuned next week, same time, same Zoom at 7 o'clock next Tuesday. We will be talking about holistic coping strategies for our cancer survivors. So I wish you all a good night and thank you again.
Thanks for having us.
Thank you, Heather.
Thanks so much.
Night, everybody.
Good night,
Thanks,
everybody.
Heather. Thanks, Emily.